Hi everybody, good morning, good afternoon, and good evening. We have people from all over the globe with us today. My name is Amir Sadeh. I'm one of the co-founder of CliniCrowd. We have also Eric Sheffer with us.
Hi everyone.
We're happy to have you with us and very excited to tell you about our story. Actually, CliniCrowd is a social impact company that aims to revolutionize the way healthcare is delivered. We truly want to put the patient in the center, and we think that he deserves it. So, there is a delay between slides, so I'll wait a few seconds before I switch slide. You can ask questions by chat, or you can email question after the webinar. You'll get the slide via the emails, and then you can ask also questions, and you'll get answer within a day or two. We promise to answer all the questions. Questions that everybody is asking, we'll send the answer to everyone. So, how it all started. Our friend Dan was diagnosed with Parkinson's about 5 years ago. Dan is one of more than 10 million people living with Parkinson's around the globe. So we as a friend, we start searching for solutions for his Parkinson, and we wanted healthy and effective solutions. One of our friends sat next to a stranger on his flight to China, and this stranger was Professor Danny Segal from Tel Aviv University, who told him that about 4 years ago, he investigated Mannitol, a off-the-shelf food supplement, as a possible solution for alpha-synuclein, the protein that causes the Parkinson's.
Okay, let's talk a bit about Parkinson. Most of you probably know that Parkinson is a chronic progressive disease. Not many people know that the cause for Parkinson is a protein named alpha-synuclein. The alpha-synuclein is produced in everybody's cells, and especially in the brain. In patients with Parkinson, the alpha-synuclein that is produced is abnormal. And what happens when an abnormal protein is produced? It clumps. And when it clumps, it causes the cells that produce dopamine, and dopamine I assume most of us know, or at least heard about. Again, back to the alpha-synuclein that is abnormal, what happens is the cells that are producing dopamine are dying because of this alpha-synuclein. And the production of the alpha-synuclein is daily or constantly. And this is why it is a progressive disease, because more and more cell that produces dopamine dies as the time progresses. Also, I want you to know that most of the drugs are dealing only with the symptoms, and the symptoms are continuing to worsen, and the drugs are effective for about 4 to 5 years, and then you have to increase the doses of the drugs, and the side effects are also progressive, and there are horrible side effects. Amir, do you want to tell us about
There are all those side effects of the Parkinson's disease, like depression, like illusions, like other side effects as well. And okay. Someone told us that we were on mute, so we start over again. Let's see what. Touchdown. 1, 2, 3, 4. It's working.
Okay, so in case people did not hear us and we were for some reason on mute, we'll start over. For those who did hear us, so our apologies for hearing this part again. Amir?
Okay, so we are very excited to present CliniCrowd today. This is a project that we are very proud of. Actually, CliniCrowd is a social impact platform that aims to revolutionize the way healthcare is delivered. We really want to put the patient in the center. We think the patient deserves it and should know about solution to disease. This webinar will take about 40 minutes. You can ask questions via chat, or you will get the webinar via email after the webinar, and you can report this question, and we promise to answer all questions within a day or two maximum. I know that there is a small delay between slides, so I'll wait a few minutes before I start talking from slide to slide. So,
Amir, do you want to present yourself?
My name is Amir Sadeh, and I'm one of the founders of CliniCrowd. We got Rich Sheffer with us, also one of the founders of CliniCrowd.
Hi, everyone.
How it all started. A very good friend of us named Dan was diagnosed with Parkinson's about 5 years ago, and Dan is one of the more than 10 million people living with Parkinson all around the globe. And as a friend, we start looking for solution for his Parkinson, and we're after solutions that were healthy and effective. One of our friends sat next to a stranger on his flight to China, and this stranger was Professor Danny Segal from Tel Aviv University. They started talking, and Professor Segal told him that he was investigating Mannitol, off-the-shelf food supplement, and its effectiveness on alpha-synuclein, which is the cause for Parkinson's.
Just 1 second, please.
Okay, so we'll keep on.
Okay, we're trying to solve a technical issue for those who cannot hear, and I will continue with explaining about Parkinson's. So what do we know about Parkinson? We know it's a chronic and progressive disease. We know that the symptoms continue and worsen over time, but not many knows why that is the case. So what we have learned is that alpha-synuclein, which is a protein which is constantly being produced in everybody's cells, in patients with Parkinson is being produced abnormal. And when it's produces when the protein is abnormal, what happens is that it clumps. And when it clumps in the cell that produce dopamine, it causes the death of the cells. And this is why a lot of the drugs are in order to increase the amount of dopamine. So what we know about the drugs are treating only the symptoms. The symptoms are continuing to worsen, so you need to increase the amount of drugs and the dose of the drug. And when you increase it to a certain amount, the severe side effects happens, like depression and other severe side effects. And there's only a short time that all the medications are affecting, and it's called the honeymoon period, and it's about 4 to 5 years. And after that, you either need to add on another drug or, again, increase the symptoms. Okay, so Danny Segal, who is the professor that we've met on the plane, he researches proteins and aggregation of proteins. And while looking at the alpha-synuclein, which is a very special protein, not only that it's involved in the Parkinson, it's also special scientifically because it aggregates in the tube. If you shake it, then it aggregates. Not many proteins knows to do that. So when they were looking on things that would prevent this aggregation, they came across the Mannitol, and they knew that Mannitol is approved by the FDA and EFSA as a drug, and they also knew that it is a supplement or sugar substitute. So they felt very happy when they discovered that in the test tube, the Mannitol have diminished the aggregation of the alpha-synuclein. The next step was to check in an animal model. An animal model for Parkinson is fruit flies. So what they did with the fruit flies in order to make it more specific is that they used fruit flies that were genetically engineered with the human gen for alpha-synuclein. And what they saw that comparing two test tubes, one with fruit flies that had the abnormal gene of human gene of alpha-synuclein and one that both test tubes did have the abnormal gene for alpha-synuclein. One was fed with mannitol and one was not fed with mannitol. What happened is that in the test tube that contained mannitol, the fruit fly gained their motion abilities or motor abilities, and in correlation, the amount of alpha-synuclein clumps in their brain was decreasing 70%, which is dramatically in comparison to the fruit fly that were not fed with mannitol. The next step was going into a larger animal model, the mice. Amir, you want to take it from here?
And for this purpose, Professor Segal and Gazit joined hands with Professor Eliezer Matzliach from University of California, who known for his Parkinson mice, and the results were more or less the same. The amount of alpha-synuclein in the brains of the mice was reduced by 70%, same as the fruit flies. There was very, very amazing results for this test. Mannitol can significantly improve Parkinson-like symptoms in the animals model.
As well as the aggregation of the alpha-synuclein. So,
and that was the first time ever that anyone deals with the cause of Parkinson, the alpha-synuclein, and not just a symptom like all the medicines in the markets.
So what else do we know about mannitol? As I said before, there are two forms of mannitol. One serves as a drug, and one is a
food supplement.
Food supplement, yeah. The one that is served as a drug is given via IV in large amounts and have quite amount of side effects.
You can see down here in the slide.
The mannitol that is approved as a food supplement is approved since 1972. It's very common in the food industry. It's very common in nature, actually, in bacteria, in yeast, in algae, and also is produced synthetically. According to everything that we know, there's no difference in between the forms, the synthetic one and the natural one. Most commonly, it is produced synthetically. Amir, do you want to say something about the chewing gums?
Yeah, first it approved by the FDA, the Food and Drug American authorities, and the EFSA, the European Food Authority, since 1972. It's commonly used in cakes, in ice cream, low sugar ice cream, in candies as coating, and in chewing gums. If you know the white powder on chewing gums, it is the mannitol. It also can be used by diabetic patient according to the FDA approvals.
Yeah, as an alcoholic sugar.
The only side effect that knows about the mannitol as a supplement is that if you take more than 20 grams or 0.71 ounce per day, it can have a laxative effect. This is the only. So if you
and also the gas, it can become a bit windy.
Yeah. So if you search the internet for mannitol side effect and you find a lot of frightening side effects, this is probably related to the mannitol
as a drug.
As a drug that you get it IV. So why haven't we heard about it so far? It looks so promising, and it's happened 4 years ago. So actually, drug development is a long process, and all the certification take a lot of time and a lot of money. It takes billions of dollars and
about 10 to 15 years to develop a drug.
The current PD drug market is about $4 billion annually for farmers and about $2,500 annually for PD patients. Mannitol cost is about $140 annually and require no
prescriptions.
Exactly.
No prescriptions at all. You can take it over the counter.
Yeah. So pharma companies have no incentive to share this knowledge with their patients, 10 million patients, because there is no financial agenda, and you cannot patent it. Everyone can buy it over the counter. So there is no interest on their side to share this information with the Parkinson community.
Yeah, no incentive to market it at all.
So Professor Segal and Gazit try to go to the next step for human research, but no one wanted to finance this research because, as we mentioned before, there is no finance
incentive. But Amir, I think I forgot to mention that after the fruit fly, they went into mice.
Yeah.
Okay.
Okay. So what they did, like each and every professor that didn't receive a grant for his research, they published an article on their finding in the JBC, which is a very well-known academic newspaper and website, and kept on with their life. Surprisingly, after a few months, they got an email from a professor in Cornell University in the United States saying that he was diagnosed with Parkinson a few years before, and by chance he got to the article of Professor Segal and Gazit. He saw there is no safety issues and he got nothing to lose, and decided by his own to try the Mannitol. He started with 1 spoon in the morning, 1 spoon in the evening, and after a few months, a full improvement is in Parkinson symptom. Professor Segal was quite excited and asked him to keep on reporting, and this guy sent emails every 3 to 4 months, reports on improvement in his Parkinson symptom and reduction in his Parkinson medicine.
Now, when Amir said that Professor Segal was excited, I think I heard him several times saying that this is one of the most exciting days in his life. He was very emotional about it. Yeah.
So since then, Professor Segal got additional 20 emails from people all around the globe. Many of them, they all said that they got nothing to lose because Mannitol is safe, and most of them reported improvement in their Parkinson grade symptoms. So for us, it was very easy to tell Dan, hey, my friend, you can try Mannitol, and we all pray that it will help you. But we have decided to take it one step further and to establish a platform that will be a game changer and will focus on solutions for disease that the pharmaceutical companies have no financial interest to publish. And the second side of the platform will use the wisdom of the crowd to test the efficiency of those solutions in stopping, improving, and or preventing those diseases.
Hopefully, providing additional substances or additional possibilities for patients that will not take 10 or 15 years for them to receive.
And of course, patients will be able to monitor and manage the specific disease by the crowd from the crowd. So, this next page, we met with the neurologist of Dan. We told her about her story. She was very skeptic in the beginning, but fortunately we brought Professor Dani Segal with us, and she was impressed that there were a very, very
solid scientific base behind it, yeah.
And a very good research. And we also brought the FDA approval, and she shows there is no safety issues here. So she said a few things. First one, that the good neurologists see a Parkinson patients once in 3, 4, sometimes even 9 months. And that's also for 10, 15 minutes. Yeah. And they can talk only about 1 or 2 symptoms of the Parkinson. Most of the time, it changed the doses of the medicines. Got nothing else to do. And secondly, she told us again about the side effects of the terrible side effects of the Parkinson, which I know very well from my father, which is also diagnosed with Parkinson, and he suffered from illusions, from depression, from all the side effects of the medicines. So we have started with the neurologist of Dan, together with Irit. We have composed a questionnaire, initial questionnaire.
Registry of survey. In our website, we call it a registry.
Okay, which contain all the 18 symptoms of Parkinson's, together with additional information about diet, about sport, about other stuff as well, in order to gain maximum information that we can share with the crowd. The first things, we met with the dancing group of Dan, which includes 25 individuals who lives in Parkinson. We came for 15 minutes to tell about our platform. We stayed more than 2 hours because they asked a lot of questions, like things that we talked about here, about the research and everything. And in the end of our meeting, they have decided they are going for it. First thing, they allocated the Mannitol supplier, because we are not selling the Mannitol in order to stay objective. Of course, if we'll sell the Mannitol, we'll have incentive that the result will be good. And we want to be objective, so we are not selling Mannitol.
Nor anything else that is connected to the Mannitol or any of the other treatments available. We are really trying to stay objective as possible.
Yeah, so they wanted to go for it. They went to our website, filled the first survey, and start taking the Mannitol. And surprisingly, after 1 month, most of them have reported on improvement and at least 3 Parkinson symptoms, like
sleep disorders. So some of them have managed to sleep better. 6-7 hours without vivid dreams. So the length and the vividness of the dreams. Also, some of them gained their smell sense back, though I must emphasize that not everyone have improved in the short period or even later on. And that's fine, because all we want, or anticipated at least at the beginning, was that we will prevent the deterioration, which this itself is a huge improvement.
So we start with this group of 25 people, and it started going from ear to mouth, from mouth to ear, and in less than 2 months we got more than 1,800 patients in our platforms reporting. And At this stage, we met with Avihu Bin-Nun, who was former head of the Israeli Air Force, who also diagnosed with Parkinson a few years ago. We told him about the project, and he wanted to give it a try. After 2 weeks, his daughter called us very excited. She said, "What did you do to my father? His voice got back normal. We understand him on the phone. We understand what he's saying." And this was huge.
It was a very emotional day for all of us.
Yeah, and from here it was a short way to get to the Channel 1 news. And after this item in the news, we got thousands of people in our platform, and today we manage more than 4,000 Parkinson patients from all around the globe in our platform, which is generic, protected. We invest a lot in security. And so, what the patient can gain out of our platform. First, he can maintain a clear record of his disease-related data on a protected registry. It means if he fills the initial registry and a follow-up every month, he can follow his symptoms, Parkinson's symptoms, all over the time. The second is he can compare his progress comparing to the other community guys in our platform, the average improvement. You can see how he is progressing comparing to the other communities. He can share relevant data with his doctors. As I mentioned before, a good neurologist sees patients once in a few months for 10 minutes. So now when he's going to his doctor, he can print his own report, which is monthly reported, and can show him what happened with all his 18 Parkinson's symptoms all over this period. And
also, I want to note and emphasize at this point that we keep a very strict privacy policy. So although you can share the information, your private information is kept only to yourself. We work according to the HIPAA compliant.
Exactly. Thank you, Irit. And of course, this method is faster than any other clinical trial that is known in the pharmaceutical industry, which takes 10 to 15 years to investigate, and we can, in 3 to 6 months, can get insight that everyone can enjoy. So, what you can do to help us, help you, and help all the others. First, join the CliniCrowd registry. Fill the initial...
It's not, I'm sorry for interrupting, it's not only a registry, it's a community, right? So, but, so you join a community and you do it by filling the registry. So you fill in the registry or questionnaire or survey. You follow up monthly. There is a monthly follow-up for it. You have to be very, very patient because it takes time. Even if you don't see improvement in your symptoms, just keep on filling up. See what happens with the crowd. Join the wisdom of the crowd. And remember that even if you don't see any improvement in your symptoms, then stopping the deterioration is a huge improvement. Share your experience. It's a community. Everyone will be happy to gain from the insight that you have and what we can gain from your data, as well as you can gain critical insight from others.
At the end of the day, we want to analyze all the big data that we are collecting and share insight with the community, like what's best work for Parkinson patient. Like taking Mannitol in the morning with orange juice works better than taking Mannitol in the evening with yogurt. Or taking Mannitol and doing Tai Chi works better than taking Mannitol and doing boxing. So that's the kind of insight we would like to share the community. And of course, it's very personal, so each and everyone can adapt whatever fit to him. We want to make the decision maker by the patient. The patient see what happens with all the others and can take decision and manage his own disease by himself.
As much as he like, yeah.
So the big question that everybody asks it, okay, it's too good to be true. What is the catch? What does CliniCrowd get out of this? It's impossible that you get nothing. So we're coming in good faith. Our only goal is to improve well-being of patients, to share information with them that the pharmaceutical companies have no interest that it will gain, and we want to make a change. We're a social impact company. We would like to make a social impact and help patient well-being of patients. We are not affiliated with any Mannitol manufacturer. We are not affiliated with any Mannitol supplier. We are not selling Mannitol, as I mentioned before. It's all for the patients. We want to put the patient in the center and help him with his disease.
We came from a friend with Parkinson. That's everyone that is in the community is becoming our friend. So same applies for everyone.
Okay, if you go to our website, there is a frequently asked questions where you can find all the questions and more that we talked here. This is our website. I hope you can see it. Here you got all the question. If you press the arrow on the left, you can see the answer to the questions. Most of them we already answered, but we want to talk about a few of them. I'll tell you, Rick. First one is, where can I purchase Mannitol? So as we mentioned before, we are not selling Mannitol.
Nope.
We are not affiliate with Mannitol manufacturers.
Nope.
But we can share with you what other patients told us where they are buying their Mannitol, and this information is available for printing or saving after you fill the initial questionnaire. The second interesting question is what the required dose of Mannitol. Irit, would you like to?
So this as well is at the end of the survey. It is well calculated from the research that Danny Segal have performed with Eliezer Matzliach and Ehud Gazit. And it is in a chart at the end of the survey. You can find it calculated by your weight.
Okay. Another, of course, you can see all the other questions. How does Mannitol work? Can Mannitol be taken with medications? Do you have to take Mannitol with food? What about heart disease, high blood pressure? All the answers are in here, and you can see them immediately.
You just have to click or on the sentence or on the green arrow. And also what I want to note is that it's an interactive platform, meaning that if you see anything that is not on our web and you would like to see on our web, any question that you feel that we didn't answer or did not address, kindly send it to us so we can add it with the appropriate reply or information.
So, yeah, that's correct to read. The last question that I would like to emphasize is, how quickly does Mannitol work? How long does it take for Mannitol to impact my Parkinson? As we know, Parkinson is a very personal disease and it affects anyone different. We have, as Rick mentioned before, we have started this program with the hope that Mannitol will stop the progression of the Parkinson. We didn't even dream that it will improve symptoms. So sometimes it works quicker, sometimes it takes longer, but at the end of the day, what we want is that it will stop the progression. And in order to measure that, you have to be very, very patient. What we hear from other patients that are trying the Mannitol in our platform, that after 12 to 30 days, they feel some improvements. Then after 30 to 60 days, there is a regression in the symptoms, but those who remain patients, after 90 days, they felt continuous improvement all over time.
So as Amir said, this is very personal, and some are like that, and other just react to Mannitol differently. So whether this is what you experience or if you have another experience, just be patient and give it time.
Yeah, thank you, Irit. And all the questions are in our website, free for everybody. You can look at them. You go to the answer. So this is our website, CliniCrowd.info. The first time you get into the website, you'll see a line in here with two blue buttons. This to enable cookies. You have to press the OK. And if there are problems, there are also in our website a few movies, videos that explain exactly how to activate cookies in each and every browser. After you push the OK, you go to disease and choose Parkinson frequently asked question to see the question, or Parkinson registry. After you choose the Parkinson registry, you get to the page where you need to sign in. You push the sign in and you get this page when you need to choose a username. The username should be unique. So if you choose a username that already exists, you will be asked to change the username. All the other first name and last name are not required. Email address is required. And you also need to choose a password. Password should be 8 digits that contain at least one capital letter, and at least one number, and additional numbers or letters, whatever you want. Then,
and it has to be in English.
It has to be in English, yeah. And then you push that you agree to the privacy policy. If you want to read it, you just push the privacy policy, and you can read the privacy policy. After you push that you agree to the privacy policy, you push sign in, and you get to the Parkinson initial registry. There you can choose your language, and if it's the initial registry or a follow-up registry.
Also, you need to note that there's additional registries of other diseases, but if you're in the Parkinson's page, then you need to see that we also have a prevention registry. So pick up the non-prevention registry if you are a person who lives with Parkinson, or you can choose the prevention if you do not have yet Parkinson.
Yeah, this is good for families, and as I mentioned before, my father was diagnosed with Parkinson a few years ago, and I'm, as his son, start taking Mannitol as a prevention, and I report it in our website as well. As we mentioned, the Mannitol prevent the clumping on the alpha-synuclein in the brain, so if I have a chance to get Parkinson because of my father, I want to prevent it from now, and I'm taking the Mannitol because it's safe and I got nothing to lose. On April 11, we'll mention the 200 years since Parkinson was first diagnosed as a medical condition. And after 200 years, there is no cure, no medicines that treat the cause of Parkinson. And this year, we want that everyone will participate in this campaign to get awareness from all around the globe for this stage that no one has cure after 200 years to the Parkinson. So what you need to do, it's a project of EDIPA, the European Parkinson Administration, and you have to put a post in one of the social network with the hashtag United for Parkinson's in English. You can go also to CliniCrowd website when you can download the hashtag picture, put your name, your email, title, answer this very complex answer, and then you can put your picture with the hashtag on your picture and upload it to our website, and we'll share it with all the Parkinson, and I hope that we'll gain the attention that we want from all around the globe for the cure, finding a cure for Parkinson or something that will relieve Parkinson's. Okay, I want to share with you now two movies. The first one will have evidence of 3 Parkinson patients. It's also in the presentations that you will get afterward. It's also in our website, and you can see it.
One second. We're trying to see if we can have it on a full screen. If not, we will continue as is.
The last 6 months, I take 20 grams of Mannitol per day, mixed with lukewarm green tea before going to bed with no side effects.
I was diagnosed with Parkinson's disease in November 2009. I started to take Mannitol about 10 weeks ago, and in the first 4 weeks after, I took just the low dose, very low dose, and in the 6 weeks, I'm taking 20 grams, 10 grams in the morning before breakfast, and 10 grams daily before going to sleep.
I experienced improvement of sleep and sense of smell within a month. Later on, softening phenomena of the poker face, and lately increased the volume and clarity of speech. Nevertheless, I remind myself every day that such a process takes time and that we must be very, very
in the current situations that I've got released from hand to the toilets. That's one thing. The other thing is my voice became a bit clearer, more loud. One message that I would like to give is patient. This kind time, be patient. Take it come. Thank you.
No company will be commercially motivated to research, readily available, and even extensively. So we have to take it upon ourselves. We have the opportunity and the reason for hope. So now is the time for you to join us.
This is amazing. Every time I see this movie, I'm really, really excited. These are people that has no hope about 4 months ago, and now you can see that they are smiling, they see a hope, they see the light, and we are very happy for them. The second movie is the items that was on the Israeli news about all the research. You can see the flies in the tube, you can see Professor Segal and all the others. You got English subtitles.
One second. There you go.
בשנת 2013, אשתי למעשה זיהתה שינוי בהתנהגות שלי. פעם ראשונה היא אמרה לי, אני רואה שאתה קצת רואה ביד ימין, אני מציעה שתלך לרופאה. אני כמובן נדחקתי ולא שמתי לב לזה. הלכתי לרופאה שהכירה אותי כספורטאי ופעיל מאוד, והרופאה לא היססה לרגע, מיד תור אצל נוירולוגי, אמרו לי, לך 3 צעדים קדימה, לך 3 צעדים אחורה, יש לך פרקינסון.
דני בסלי, איש מערכת הביטחון לשעבר, ואביהו בן-נון, מפקד חיל האוויר המיתולוגי, גילו לפני כמה חודשים מחקר פורץ דרך שיכול להקל משמעותית את המחלה שלנו.
המחלה הזאת לא ידעתי מה זה כתוב. והפעם יש לי מגוון שאני צריך לסדר אותם בקופסאות מיוחדות כדי לדעת לקחת כל פעם
חלק מהם.
המעבדה שלנו באוניברסיטת תל אביב נותנת חלבונים שונים שמקבלים בצורה לא תקינה, ובעקבות זה יוצרים צווארים רגילים בתאים שונים במוח. זה להכיר למשל אלצהיימר, פרקינסון, ואז לאחד מהמחקרים האלה עשו את המקרים של סדרה של כמה עשרות חומרים.
אז הם נכנסו למעבדה ובדקו עשרות חומרים כדי לבחון אם אפשר לעכב את תהליך ההצטברות של החלבון שגורם לפרקינסון.
היו כמה חומרים שהיו אפקטיביים בניסויים הראשונים האלה, אבל מניטול תפס את העין שלנו במיוחד.
א', איש עסקים מאזור הצפון העדיף שלא להיחשף. הוא סבל מהידרדרות במחלה. לפני חצי שנה החל לקחת מניטול.
באתי לבוא על זה למניטול, חיכו לי עניינים ברגליים, הוא שריח את זה על הביבי. אני כשאני חזרתי לישון לילה שלהם.
ואיך אתה יודע לשייך את זה למניטול?
אני כל אחד קצת מהמניטול, אני מרגיש שתחרות שלנו, זה לא נגיד כנראה, כאן שם זה שיעור המניטול.
פרופסור סגל ושותפיו במחקר יצאו לדרך. מימון כספי לא הצליחו לגייס, לכן ערכו ניסוי בזבובוני פירות מהונדסים גנטית.
מצד אחד, רואים זבובים שיש להם פרקינסון, ורואים שהם בקושי מסוגלים לעשות את המבחינה השנייה, רואים זבובים, אלא שכל אחד הוא מחלו במצב שיש לו מניטול. והאפקט הוא בולט מאוד, אפשר לראות שבצד אחד הזבובים מראים על קרקעית המחלה, ובקושי זה זבובים. ובצד השני, הזבובים מתייחסים למעלה כמו זבובים בריאים.
האינדיקציות היו דרמטיות, ובשלב הבא כבר הזריקו מניטול הישר לבטנם של עכברים מהונדסים באוניברסיטת קליפורניה בסן דייגו.
ושם ראינו ירידה משמעותית מאוד בצווארים של אלפא-סינוקלין במוחות שלהם, לעומת עכברים מקבילים שהיו בניסוי הזה שלא טופלו במניטול, ועוד פרמטרים שונים של הידרדרות של המוח, בייחוד באזורים הרלוונטיים למחלת פרקינסון, היו מצב הרבה יותר טוב בעכברים המטופלים, לעומת העכברים הישירים.
כל אחד יכול לקנות את המניטול בלי מרשם רופא. 800 חולי פרקינסון כבר מעידים על תוצאות מיידיות ומשמעותיות. מקצת החולים אף הפחיתו במימון התרופות הקונבנציונליות.
בעצם כבר 3 חודשים שאני משתמש בחומר הזה, ומטפל אחד ביום, ואני מרגיש שינויים איטיים, למשל, נושא של הדיבור, שהיה חלש בצהוב, ואני מרגיש שיפור. השינוי המיידי, והמאוד בולט, והמאוד חשוב לרפואה שלי, היה שינוי קיצוני באיכות השינוי. יש לי גם הרגשה שאני יכול, לא רק הרגשה, אני מוריד במינון, ולא מוסיף במינון.
שמינון של התרופות.
אני לא דיברתי ככה בעוצמת כל כזו, קשיות בפנים, הייתי הרבה יותר פוקר פייס, וקצת מתווכח לי.
המניטול הוא האבקה לבנה על המסטיק שלכם, חומר טבעי המופק מצמחים. מקור שמו מהמן התנ"כי שהוזכר במקורות בטעמו המתוק.
יכולה לטעון, בסך הכל ראוי למאכל.
זה גבישים או... את האבקה הלבנה אפשר להוסיף על כוס הקפה אפילו בתור ממתיק לעוגה. אין תופעות לוואי, אם כי במינון גבוה תיתכן קיבה רכה.
המטרה שלנו זה לעצור את הידרדרות המחלה. אם נוכל להוסיף את זה כמו שזה קרה עכשיו, זה הדבר המדהים שקרה פה.
שם המשחק הוא כסף, ונדמה שחברות הפארמה כבר מזמן הפסיקו לחשוב על החולה. את האבקה הלבנה הם לא יוכלו לרשום כפטנט, כי אז המיזם החברתי של המניטול הוא אויב המפריע לשוק תרופות הפרקינסון להתקיים.
כל אחד יכול לקבל מניטול מאמזון או מכל מקום אחר, בלי שום צורך ברשם שלו, וצריכים על הכל טוב, יש לנו כסף.
לשם השוואה, קופסת אבקת מניטול נמכרת בעשרות שקלים, ומספיקה ל3 חודשים. עלותן של תרופות הפרקינסון בין 100 שקלים לאלפים בחודש.
אמרתי, אין לי מה להפסיד, זה חומר טבעי שמשתמשים בו, ויש לו כל האישורים הרלוונטיים. גם אם זה אוסר את
התפתחות של מחלה. ופתיים זה מקל וכמה סבלנים. אז אני הייתי ממליץ לאנשים לנסות את הדבר הזה, הוליד תקווה בקרב כל מי שנחשף לזה מאובחני הפרקינסון, כל התרופות עוסקות בסימפטומים. פתאום יש פה משהו שאולי בזהירות הראויה, הוא מתחיל לייצר מענה למחלה עצמה.
Okay, that was a very exciting movie. So what we would like, our disclaimer is that we are not providing any medical advice. We are just sharing information with the crowd. For medical advice regarding how to manage your disease, please consult with your doctor. So if you have any doubt, I'm diabetic, can I take Mannitol? Ask your doctor. I have high blood pressure, can I take Mannitol? Please consult with your doctor. Or any other doubt, even the lowest doubt, please consult with your doctor. We are doing this only to share information that the pharma companies has no interest to share with you. That is all for now. We would like to thank you so much for your participation and would like to ask you to participate in April 11, the Parkinson World Day. Thank you so much. You can ask any questions that you want via our website, via the chat now, and we'll answer questions to everybody within a day or two. Thank you so much and have a great day.